Well, good morning, everyone. It's great to be here in such good company to talk about, a really calm area of our world. My name is Kiana Scott. I am a communication and strategy consultant working with mission-aligned organizations. I also teach at the Evans School of Public Policy and Governance at the University of Washington. I work with clients including the Washington Association of Land Trusts, Plymouth Housing, Common Power, and I've seen a couple of faces in this audience that tell me you know exactly who I'm talking about. So our world feels like it's on fire. The situation is not normal. We are navigating extraordinary, unprecedented times, and unfortunately, we've been doing so for quite a while. So I don't know about you, but I'm both tired and know there is desperately needed work to be done. So I'm delighted to be joined on stage by leaders representing different nonprofit organizations who are doing incredible work on the ground across our state. I'm going to start today by asking you each to introduce yourselves, share where you live, your professional role, and something interesting about you. Rhonda, I'll start with you.
Well, good morning, everyone. My name is Rhonda Hauff. I'm the CEO for Yakima Neighborhood Health Services. We are a community health center. I didn't get the memo that we're not going to talk about healthcare today, so I'm going to talk about healthcare today. I have been Yakima Neighborhood Health Services is a community health center. We have 7 locations in Yakima County. We also provide about 200 units of permanent supportive housing across the valley, and I have been with our organization for 42 years. We are celebrating our 50th anniversary this year, and one of the things that I've learned over those 50 years is that everything we have done meaningfully in our organization, we have done in partnerships. So you will hear me talk a lot about our partnerships across the valley and across the state. I'm also a board member of Building Changes, which is based here in Seattle. That I see a lot of nods. Many of you are familiar with that. And then a few other organizations that you'll hear me speak about. One of the things I think that's probably what I'm told is interesting about me and the reason I'm so passionate about the things we're going to talk about is I'm a product of a World War II bride who was from Casablanca, Morocco. She was a French-Moroccan Jew. My father was first-generation German, and so I learned a lot about diversity and equity long before I ever knew what those words meant. And so my passion for equity and diversity, I think, come from my upbringing, and the reasons for the importance of those things, have been part of my life forever. So I think I'll stop there.
Thanks, Rhonda. Hi, everyone. My name is Siobhan Ring. I'm so happy to be with you all. You. And I work at Firelands Workers United, Trabajadores Unidos, and our sister organization, Firelands Workers Building Community Power. Our work is centered in Grays Harbor and Pacific counties in rural Southwest Washington, and we build multiracial worker power to organize across race and language in English and Spanish and some third languages, in order to win the things we all need and deserve to have a good life. Healthcare, housing, healthy homes that aren't filled with mold, where we can cool our homes without opening the windows and letting the wildfire smoke in, and freedom and safety for all of us. And, our members work in canneries, work in the logging, work in the mills, work in Walmart, work in home care. Our members work across all sectors, and we are a super majority women-led, immigrant woman-led organization. And that is part of our culture, and building that power and that leadership is everything about the solidarity we bring and the work we bring. So I'm honored always to be part of that organization. And something about me is that I live with the constant contradiction that I work in a place-based organization. I don't live in the place. I don't live in Grays Harbor County. I live in Seattle, and I've been a city dweller my whole adult life, but I grew up in a rural community a lot like communities in Grays Harbor County. I'd say Elma is the closest to the town I grew up in. And I've lived and watched the same forces that are driving poverty, disinvestment, rising white nationalism, and the struggles of the climate, I watch those move through my own hometown the same way that they are moving 3,000 miles from the towns that we work in Grays Harbor County. And so I'm so honored to have that roots come back to my roots in that work.
Thank you. Hi, my name is Demay. I am one of 5 co-executive directors at the Clark County Volunteer Lawyers Program. I should say all 5 of us are women also. We are a civil legal aid organization that serves Clark County, Washington, so in Vancouver. We utilize both staff and volunteer attorneys to provide free legal advice and representation to folks who can't afford it or can't otherwise access it. If you are not a wealthy white man, it's really hard for you to get positive outcomes in the court system, and we recognize that, and we are constantly trying to change that. My specific role is in community engagement, and which is just so perfect because I swear I came out of the womb with such a strong sense of justice, and so I really get to do what it feels like I was born to do constantly, and to be in community, to be telling folks about important work, to connect with other amazing nonprofits and folks that do such good work. So I'm really just honored to be here.
Hello, everybody. How are you? I think we can do better than that. How are you? Okay. There we go. So I'm Shalimar Gonzales, and I serve as the CEO of Solid Ground, and our work happens both in King County and in largely North Seattle, and we're an anti-poverty organization and economic justice organization. I'm also here representing Washington State Community Action, so that is the 20-plus anti-poverty organizations that are based in the state of Washington. And as much as I love to cheer for the Mariners, I am a Bay Area girl at heart, so I'm very sad that the Giants have been eliminated. It's very sad for us, but go 49ers. I know, it's a tough crowd over here, a tough crowd. But I am excited about this conversation today because I get to say all the stuff here I hope that I can't say to our federal contract monitors any longer. So I get to talk about racism, I can talk about social justice, I get to talk about equity, I can talk about gender, I get to talk about LGBTQ rights, all the work that Solid Ground does, that now we have to frame differently, even though the work still is there. I get to say it loud and clear and very proudly here. So I'm looking forward to this conversation and hopefully not bringing everybody down.
Well, thank you, everyone. And Shalimar, I'll turn right back to you for this first question. I want to ask you all about your organization's mission and how you continue to do the essential work you are doing amidst and despite changing policies, changing political pressures, both formal and informal. Shalimar, you just mentioned some of the things that you're very committed to continuing to advance. Thank you. Keep it up. How do you think about this? How do you do it?
Question. We do it in partnership with community. I think for an organization like Solid Ground, for many of the organizations that are represented on this stage, we can't do our work unless we're strongly rooted in community. It's the community is what holds us together and what's going to kind of see us through all these ebbs and flows and the changes. And Solid Ground's been around for 50 years and it's seen lots of change. I started 4 years ago in the middle of the pandemic, and I thought that would be the hardest thing I ever did, and then here I am. Doing this now. But the community is the thing that tells us how we are going to move through. The community is our North Star. And so if the community says to us, we don't want you to stop talking about equity, we don't want you to stop doing housing work, we don't want you to put our information into a national database to screen whether or not we are documented or undocumented, which was the most recent request last week. We don't want any of those things, then we won't do those things. And that means that then it makes maybe my job a little bit tougher. It might mean that I have to find money in different and more creative ways. I have to braid funding in different ways. And that's okay, because at the end of the day, I know that I am representing, I'm standing beside community and with community for what they need. And that is how we root ourselves in our mission. So for us, that is how we do our work. That's how we'll continue to do our work, despite all the, to be honest, like all the bullshit and all the crazy, hopefully I can swear Hope that's okay. Okay, all right. Okay, great. I did not ask. I just jumped right in. All of the stuff that we're seeing, all the nonsense that we're seeing at the federal level, even at the local level, let's be clear, it is really, really important that we remain as organizations and as funders true to who we are in terms of caring for and successfully lifting up community and community needs.
Thank you. First, give it up for the way that Solid Ground is staying grounded and deeply solid and not complying, right? What did they tell us? Don't comply in advance, don't comply after. So I would just like to give you some praise and some appreciation for that. It's not easy. It's easy to say right here. It's not easy to do. And I think that that is some of the complexity that organizations like a lot of the folks I'm up here with who are providing the direct services on the ground, the survival services, the things that keep people alive, safe, housed, and fed, are contending with every day. At Firelands, we're a power building organization. We organize, and we are not providing direct services. And that is a contradiction we live with every day because we live in a disinvested community. The last 40 years of neoliberal policies have devastated rural areas in the destruction of public goods and the defunding of our schools and the lack of access to health care. And so we live with the constant contradiction that we've built this beautiful institution that people trust and love. And when federal money started coming down in the last administration for things like home repair, which is one of the priorities we hear on our canvas on the doors every day, people said, you guys should apply and implement this. And we said, that isn't what we do. We are not out here to fix roofs. We are out here to build a public system where roofs don't leak, where people don't have to beg so that their children are not living in a house filled with mold. But that is a contradiction that we lived with, and we made decisions not to pursue federal funds, and those were hard choices. They were not simple for us. But they also mean that we're not subject to those, that particular path of repression. And so how we have to pivot in response to these conditions looks a little different. I'm gonna tell you a story. So as I said, we're a supermajority immigrant women-led organization. Our base is about 85% immigrant folks, immigrant families, and working shoulder to shoulder, side by side with US-born, largely white folks. That's the demographic where we work. But actually our base is a political home for lots of people, for African-American folks, for Asian American folks, for indigenous people. And in the first mobilization that we had planned during the last state legislative session, which was at the end of January, beginning of February, there was a credible threat that ICE would be on campus. And we had 45 people prepped to go talk to legislators, bring their voices, fight for healthy homes, fight for housing, fight for rent stabilization. And we had a 2.5-hour Zoom call the night before we were planned to go. We did a 2.5-hour Zoom call in 2 languages, which all our work is in both languages. And we supported people through grief, through fear, through assessment of how to take risk that is rooted in power and love and reality. And we had to make new decisions. I mean, our folks navigate risk every day, but we had to make new decisions. And one of the ways we pivoted is that for folks who felt like they were unprepared for the risk presented by that day, we organized a local action at our offices. We had over a dozen people there making phone calls, writing letters, making videos for lawmakers, and 25 folks still went. And we went with a security plan and a nervous system level of upregulation that I have not experienced in some time. And multiple children, teenagers who've been in our work since we started 6 years ago, took the day off school. And when we said, why are you here? They said, I am here for my mother. Because my mother can't be here because of my little siblings, but I am here. And now we have a youth program where those leaders are not just there with their mothers, but they are building the next generation of Firelands. So we ground in our power. We accept our fear, we accept the things we are not able to control, And we build that with like radical love and solidarity. There was no judgment. There was, you stay here. We are all in this together. We live streamed the rally on the steps for the folks in the office. So that's just one story of how we pivot.
So I myself am a non-attorney, but I work in an organization where there are quite a few staff attorneys, and I work with volunteer attorneys constantly. It is very interesting. I love attorneys, but it's interesting. If any of you are attorneys in here, I'm sure you're one of the good ones. But one of the, challenges is we are very careful about our wording, all of that stuff. But one of the privileges is that we have such a wonderful network of attorneys. When we wonder, are we breaking the law? Are we in violation of anything? We can call on those folks to say, no, you're not doing anything wrong. There is nothing illegal about centering equity. There's nothing illegal about centering diversity. And, morally we know that, but it does feel good to have that legal backing. And especially my co-director who does risk management feels a lot better knowing that we are not breaking any laws. One kind of having that backing, one pivot that we have made, our mission is the same. It will always be the same. We are steadfast. That's never been a question. What pivot that we have made, however, has been that the way how we are communicating to our community what our current work is has been a lot more intentional. So, we are very intentional that we are not causing any risk to any clients that are trying to seek our services. So we have folks who are undocumented, we have folks who are BIPOC, we have folks who are living outside, and we are making sure that when we advertise what we're doing, we are intentionally not saying some of the immigrant safety planning work that we're doing. We are not calling undue attention to our clients and to ourselves. So just being smart and being strategic and intentional. We've been doing some queer outreach this year, so kind of know your rights presentations specifically for queer folks. Our queer community says that they feel safe in Vancouver for us to advertise this and for us to talk about it. And so we're taking their lead and we feel comfortable. However, when we do our safety planning events, we know that it is not safe for our immigrant families to talk about these and to advertise them. So we are doing pure word of mouth. We're really leaning on our partners who are already doing the work, who are already in those communities to help get the word out. But it comes with a challenge in that as an organization that's very honest and transparent and vocal about the work that we do, it almost looks like we're not doing anything right now because we're being so quiet and so under the radar. But I think part of that is we have such a trusted relationship with our community, with our partners, with our funders, that when we tell them, we promise we're doing the work, you just might not see it right now, they still trust us and they still know and they honor that. And we have even more supporters than we did before. But it is really, how do we minimize risk and harm for ourselves, but still do the work? Still, if we're gonna walk the walk, we're gonna talk the talk also.
So likewise, our North Star in 50 years, over the last 50 years, has really been about our relationships. And I talked earlier about who our relationships are. And I would say in the last 8 months, I've spent more time with attorneys than I probably have over many years before that. They've become important partners to us. But along with our mission, we know who we are. And like many organizations, we have had to scrub many words that have been in our mission, in our value statement, and in our vision statements. And that was okay with us because we know who we are, and our patients know who we are. And when I was preparing for this and talking with a couple of my coworkers, the first thing that she said to me was, think about the patient a couple of years ago, and I guess I want to preface this by saying, Yakima County and King County, there are so many things that are different about us. The northern tip of Yakima County actually touches the very tip of South King County, and that's probably the first thing that we have in common, but there's a lot of things that we don't have in common. And we, as a community health center, we provide all the primary care services that you would expect: medical, dental, behavioral health, and I mentioned our homeless services as well. But we have a very active outreach team that are trying to find and serve the unhoused. And we've had very active encampment sweeps that have gone on for the last few years. And when the encampment sweeps, there are the city staff that do encampment sweeps, and there are county staff that do encampment sweeps, and it's kind of a game of whack-a-mole. The city staff go to one part of the city, and then they push people out into the county, and then the county staff go out and do encampment sweeps, and they push people back to the city. So our street outreach team are typically out there trying to mitigate and help people not find other places to hide, but to help people access services. And we had an individual that made the comment to one of our outreach workers, and he said, "I saw the white van with the logo coming, and I knew things were going to be better." And it was a reminder to our staff that, we have a reputation that we're there to help. And we can't solve everything, but we're there to help. And whether it's to provide, a blanket or some socks or some water or something during whatever is appropriate in the season, or, we don't have enough housing, but we have something that can help, or getting into a behavioral health counselor. But we know who we are, and even though we might have to take the words that we're using or change the words that we're using, we know that we're there, and the people know who we are and what we can do. We don't make promises we can't keep, but we are very creative in the things that we do. We're one of the poorest counties in the state of Washington, and we have lots of people with challenges. The very fact that we serve really poor people makes the people we serve very vulnerable. They're not very popular right now. And I was telling a story to my peers here when we were preparing. If you've come to Yakima, on the exit nearest our mothership, there's an entrance that says, "Welcome to Yakima, the Palm Springs of Washington." But if I had a PowerPoint, I would show you. That's one of my slides. My daughter happens to be a graphic artist, and so on one of my presentations, depending on the mood and the audience, I had her adjust one of the slides that says, "Every man for himself." And I don't usually show that when our own policymakers are in the room, because they wouldn't appreciate it. But, in the healthcare world, we are very much in a world of value-based care and pay for performance. A lot of our contracts, we go, as a community health center, we go looking to serve people that others don't want to serve, and it can be very challenging. But, many years ago, there was a study that shows, 20% of people's health can be impacted by, the clinical indicators, and by heredity and genetics. 80% of their health is really impacted by the environment. And so it really takes all of these other things that affects the environment and their social factors, and that's why we're there. And those are so many of the issues that are being attacked right now, and that we can't let go of, and we won't. I was in a meeting not too long ago with my peers in the community health center world, when we're talking about how do we adjust, and how are we going to affect all of this. And my comment was, and you could tell my age by this comment, we are the resistance. We are now the resistance. And our civil disobedience as a boomer is, the resistance is not giving up on social determinants. We have to show how we can keep up. We're going to maintain how we help people into housing, and how we support the environment. And climate change is not a hoax, which was the claim of the last week or so. And so we can't change our priorities just based on maybe what somebody else is changing. Vaccines. What are we going to do about vaccines? Well, I've said this so much in the last few months. Thank God we live in Washington State, for so many reasons. That we have an administration that really supports all the initiatives, and that we now have a coalition that is guiding us. And I guess the last comment, the example that I would give is, as a health center, and vaccines around. First, we were dealing with the COVID vaccine for healthcare personnel. And we always took our guidance from the CDC and then the State Department of Health. And so she was, our CMO is a woman that's been with me for over just 30 years. And so she was updating our policy for healthcare personnel. So she looked at the CDC, well, not a lot of guidance there right now. So she looked to the Department of Health, and they were, a month ago, they were somewhat restricted on what they could say. She went to a local health district, they were a little restricted. And so the answer was, we really need to look at our community standard. And so we started looking at the community standard. And then it was about the general public and what could we do. And that's when our Western Coalition was forming and making recommendations. And it's not really wasn't about just the recommendations. The recommendations guide who's going to pay for the vaccines, right? And so, 75-80% of our patients as a community health center are covered by Medicaid or they're uninsured. And so if there's no way to pay for it, then that is a very decisive factor for the populations that we serve. So again, thank God we're in Washington State and we have a coalition, and now that they've decided that these recommendations are valid, that we need to continue these vaccines for children and for the uninsured, and so our state Medicaid is going to pay for it, or for the uninsured, our state's going to cover it. And so we can continue with the guidelines that we've had. So that's just an example of how we're currently able to continue on our mission.
Yeah. As I was listening to my colleagues on the stage speak, there's an undercurrent of a piece, and I didn't want it to go unrecognized and unnoticed. And it was this idea of working with a sense of urgency and working in a sense of frenzy. And these agencies and many other ones that are serving our community, that are community-based, that are rooted in their mission, are agencies that are focused on working right now with a sense of urgency, because that is what the time is calling for, but not being frantic about it. And so often, and you made the comment around we're doing the work, you just may not see it. Of course you're doing the work, but people right now expect frenzy. They expect 50 million messages going out every single moment, and all the tweets, or we're not on Twitter anymore, so Blue Sky, all the other spaces, and for there to be an assembly of panels and all sorts of other things to talk about. What are we going to do about that? That's frenzy. That's frantic behavior. And when we are frantic is when we start to make mistakes. When we are frantic is when we start to leave community behind. And it's when we start to hunker down as agencies and really focus just on ourselves and our own individual resources. And I think at times right now we see agencies that are hoarding resources. They are looking at their own mission and they're saying, yes, we do diabetes prevention programs, and we're also going to all of a sudden start selling shoes because that's what we need to do right now. So everyone is trying to find all the resources to keep their teams and themselves whole, but that doesn't necessarily serve community. And so the themes that we heard this morning, at least so far, have been around working in partnership, working in collaboration. That's the thing that's going to get us through, and making sure that we're continue to stay rooted in community in the time of urgency that we need right now, without being crazed about it.
And that's what allows us to be both urgent and sustained, right? Because this isn't quick work. I want to turn to one of the very powerful tools that the federal administration has used to curtail the activities of organizations it doesn't like, and that's federal funding. Some of your organizations have received federal funding in the past, some haven't, but with the reduction of federal funding, how are you thinking about your work? How are you changing your work? How have you reacted to that, either reactively or proactively? And Mia, I'll start with you.
Thank you. So at the CCVLP, we have intentionally not taken on federal funding or contracts so that we are able to serve folks who are undocumented without any barriers. And that's always been a priority of ours. It's always been a really, really intentional choice of ours. Full disclaimer, we have some federal funds that come to our organization, but they're through pass-through grants for community partners who are the primary recipients. However, in the fall of last year, prior to the election, we, with one of our really close community partners, was awarded a pretty significant amount of money, federal dollars. And it would have allowed us to hire additional staff attorneys, which is really huge for us because they can take on cases. We can have more capacity. They can take those cases that will have a larger effect in the community. So we were really excited. We could have done a lot more preventative work. When the administration changed in the winter, spring, it's all a blur to me now. We were told that we would still get the funding if we wanted to pursue it. However, they sent us a renewed contract, which was completely different from what we had received when we first got the funding. And there was new language in there that we just felt really uncomfortable about. And we worried how it would have a chilling effect on our mission, how it would prevent us from talking about equity. Our entire mission is that we believe no matter your race, your gender, your income, you should have the same outcome in a court as anyone else. You should have equitable access to justice. And so that is the heart of our work. And so to have that threatened at all felt really, really scary. And it also felt really scary for potentially our clients and what it could do to them. Talking about demographic reporting is really huge right now for nonprofits, and so confidentiality is obviously what we have to uphold, but when there was potential that we would maybe have to give up client data, again, we just felt like this wasn't a good choice. And so we as the director team sat down and had a lot of really hard conversations about it. But ultimately, we decided we were going to turn down the funding. And again, we are not a huge organization, and without getting into details, it would have been significant. But again, we didn't want to open ourselves to risk to our clients. That is what we need to be keeping safe right now. The folks who are at risk and who are seeking social services like this need to be protected. And truly, we thought if we were ever going to take federal funding, this was absolutely not the time to do it. And so why would we get into that? So we were very transparent with our community partner who also had the funds and told them throughout the entire process what our thoughts were, what our concerns were, really trying to maintain that relationship with them. And we were also so incredibly transparent with our staff throughout the entire time as well. They were planning on building up a whole new program and adding all of these staff and staff attorneys, again, which is really significant. But when we communicated to them what we thought could have been at risk and the overall safety of the organization, again, just kind of the culture of our org is that we're transparent and that we honor our staff, and they had our back 100%. They weren't upset with our decision. They understood. And really now what we've been pivoting to is, again, if we're going to talk the talk, we're going to walk the walk, and leaning into our existing funders that we've had for so long that know what we do, that know that we did turn down funding and are kind of helping us out even more so now. So again, really relying on, really relying on folks who do trust-based philanthropy, which I know is very much speaking to the crowd here, and learning that it's okay, we can make adjustments. I also want to acknowledge, we were in a privileged position in that it wasn't going to take away funding, it would have just added funding, and so I know that we are in a different circumstance than some nonprofits have had. But yeah, it's a tough decision, but ultimately I think we feel really good about it, and if it would have threatened our organization, there's no point in doing it.
For us, for over the last 20 years or so, we really leaned into building an integrated system of healthcare, of addressing homelessness, not ending it, by building an integrated system of healthcare and social services and housing specifically, by braiding many systems together, because what we learned is within our system of care, if we didn't make the direct connection and putting together an integrated system, it had greater senses of failing. And so our funding is very braided by intention, because our hierarchy as a community health center is not very high. And so we have several different sources of federal funding. So for us to give it up would be really devastating as an organization. And our federal funding represents maybe 20% of our overall budget. But also there's a lot of different pots of federal dollars that flow through our state funding as well. So this is what keeps me up at night, lots of nights. There are executive orders, there are interpretations of current federal regulations, and then there's this thing called PERORA, which is the Clinton welfare bill of back to 1996 that is has been telling us that community health centers fall under this interpretation that says that we should be required to verify people's eligibility when they legal status when they come into our centers, which back in 1996 the Clinton welfare bill said that we were exempt from that. And earlier this year, Washington, again, thank you, Washington State, for living in Washington State. Our state was one of 22 states that challenged that. And 2 weeks ago, I think, there was an injunction that said, nope, well, you're right now. So we're on a hold on that. So we don't have to do that. But so we, as a community health center, we have never had to ask people their eligibility for services. But imagine I mentioned earlier, we have about 200 units of permanent supportive housing, which means that we take people out of encampments, off the streets. These are people that have been chronically homeless, meaning they have lived in places not meant for human habitation for at least 1 year, or they have had 4 instances of homelessness in the last 3 years that add up to 365 days. And they have to have at least 1 chronic disability. So we help those people into housing, and we provide intensive case management. Imagine, and then we help them pay, and we subsidize their rent. If they have an income, whether it's earned or unearned, so some of them work at least part-time, some of them get SSI or SSDI. Whatever income they have, they pay 30% of that income toward their rent. And we subsidize the rest. Some of those units we own. Some of the units we master lease from private landlords, and so we pay the rest of the rent, and we use those federal funds to do that. If we gave up those federal dollars, or if it was taken away from us, those people would be on the streets again. These are the things that keep me up at night. We also have SAMHSA, which is the Substance Use and Mental Health Administration. We have some funding from them that helps us provide supported employment case management that help people, once we get their health stabilized, whether that's through mental health services or through our medical services, then we can help them work on their other issues, whether that's mental health issues or substance use, or help them into trade. Housing first. Get them into housing first, and then help them deal with their other issues, and we can help them work on their ability to work or volunteer or whatever those services are. People succeed when you do things in that order. You don't necessarily require the services, but people want to get better once they have their basic needs met. We have seen that over and over and over again. And many of the employers in our community have no idea the people that are working for them came from the streets or came from those situations. And so the trade-offs of how do we deal with the challenges of the funding issues that are being challenged. There are executive orders. Do you know there are 120 executive orders that have been signed since the beginning of this year? Look it up. There's over 120 executive orders. The 2 or 3 that are directly impacting our day-to-day work I'm mentioning, but there are a lot out there. So we really focus on, again, I talked about the words, but you kind of, one of you said this a minute ago about, do the work, just don't shine on it. And again, in communities like mine, We really pay attention to that. And then the other one I would just mention is that specific to Perora and the eligibility status is really paying attention to making sure that we're reaching the people that are afraid to reach out to us now. So one of those things is that we have been working since COVID to do a lot more around telehealth, and so we're trying to offer more services from people's homes that are afraid to come to us. We've helped a lot of folks get smartphones and to be able to maybe receive services through their smartphones for video visits, or even for applying for housing and things like that, to be able to help preserve services. But the federal funding, there's also a new term in our contracts that say that our contracts can be terminated as a matter of convenience if we no longer meet the priorities of the administration. So, at any given day, we can get a new term in our contract, or just a letter saying we don't like this anymore, so we're going to terminate this contract. So, there's no way we could pay rent on those 200 units if it's no longer favorable to the administration.
So based here in Seattle and King County, we have a luxury. We have local representation that has filed for numerous injunctions and have won them so far, and have combined with other municipalities across the country to be able to do so, both red and blue. And for solid ground specifically, and I'm gonna scan in the audience to make sure my legal folks aren't here, because they don't like it when I say this. We told those dudes to kick rocks. Nah, you can keep your money. We will figure out a way through it without all the other headaches that come with this. Because for us in serving our community, when we're particularly thinking about folks that are impacted by capitalism, which all of us are, but impacted by the systems that then become poverty for so many folks, those are the folks that are being othered right now. When we're talking about the executive orders and the changes that are happening, and whether or not someone can be swept out off the streets into jails or wherever else, some mayor may deem, as long as it follows the line of this current administration, that's just not the work that we're going to support. And if that means that we need to stop accepting federal dollars, then that's what we're gonna stop doing. And so I made a comment earlier about having a contract visit with a federal monitor. And in that, they were like, tell us about your work, as they always do. Please stop asking us those questions. Every year somebody asks me the same question, and every year I do the dog and pony show about our work. But it was important in that moment because I said all the stuff that you're not supposed to say. I talked about equity. I talked about diversity. I talked about all these things that are so inherent to the work that we do at Solid Ground, and we cannot not do it. And that contract monitor several times stopped me and was like, "Hey, just a heads up. Remember, I'm with the feds." And I was like, "I know." And I still want you to write this down, and that may mean that we're going to lose this funding, and that's fine with us. That may mean that we're going to end up on some sort of list somewhere with our bully of a president, and that's fine because we're standing true with our values and our mission and who we are. Now, granted, we have the luxury to do that. Our federal dollars are 7% of our overall budget. We're not 20, 30, 40%. I might have a different story, a little different tune, I'm saying, if we were that high of a percentage. But for us, with our braided funding, for us, 4 years ago during the pandemic, we intentionally made efforts to build up our philanthropy, and we created a larger team. We staffed that team and resourced both that team and our communications team in ways that we didn't, which caused a lot of issues in our organization when programmatic staff were saying, how come we're doubling the size of this team and I'm over here kind of left as the sole case manager for 50 clients, right? And so, but we knew we needed to do it because we were preparing ourselves for times like this, where we would have to rely on individual donors, we'd have to rely on foundations. We couldn't just rely on what has historically for us been really reliable funding in the feds. Federal money has been really good money for a really long time until now that it asks organizations like the ones on the stage to compromise their values. Now when they ask for organizations like the ones on the stage to turn in their clients, those are hard stop lines for us. We're not going to cross those. And so, yeah, we told them to kick rocks.
Right on. And I want to say just two things. The first thing I want to say is what I heard is a lot of complex risk analysis and conditions analysis by every organization up here. And that is what every organization, your organization, every one of us is doing. And that is one of the big changes, is that conditions have become so incredibly unreliable and we have lost so much power over the conditions that we are in a constant state of careful urgency. The work of self-regulation and organizational regulation is enormous right now. Keep funding that resilience work at Firelands. We have a contract with a bilingual, bicultural therapy team that provides trauma resilience support directly to our frontline organizing team, and we've had that for years, and we are upping it. Because we cannot survive if we burn each other out, if we break ourselves. And so I think that constant condition analysis also requires a lot of money. So if you're thinking about this from a position of sort of the sector, Firelands just paid $4,000 to a constitutional law expert to do a digital security and landscape analysis and recommend to us how it is that we prevent our information from being taken against our will and our people's information from being used for raids in our region. That was great. I learned a lot of stuff. I have a really long report. But then I had to hire someone to implement it because I don't know any of those things. So that's one example. And then the other thing I wanted to say, how Firelands is pivoting to these conditions is, because we are not providing direct services, our work is to not only build power and fight and win campaigns, but to change what we call the common sense in rural Washington. So in rural Washington, we have been the recipients of a multi-decade campaign to divide us, to blame ourselves for our own suffering, to erode our faith in that government can be a tool for public good, and then actually see policies erode government as a tool for public good. To reinforce that sense and that reality, and to learn to blame each other, to believe that we can have either jobs or clean air, but not both. And so it is a core of our work to change the sea that we are swimming in. And so one of the interventions that we are doing is deep analysis of very personal, very localized impacts of these massive shifts in federal funding and the executive orders, because they are invisible, and the right-wing narratives that we are awash in, and I would say not only in rural Washington, but especially in rural Washington, but we are not escaping that, as we can see in our local shifts in government in Seattle. We do interventions like when they took the 2 firefighters off the Bear Gulch fire in Mason County, which is outside of our region, but close. We actually texted 75,000 middle-of-the-road voters in Clallam, Jefferson, Grace Harbor, and Mason counties, and exposed them to a narrative of these are our heroes. And in rural Washington, we know that fighting fires is everyone's business. And we win when our heroes are on the ground fighting the fire, sign this petition. And we started a petition, and 700 people. So we identified 700 movable voters in those regions. And we are a C3 and a C4, I will say. So we do both political work and power building, community-based work. And so that is just an example of how we are trying to watch and make visible the harm and offer a new story of why.
So I want to tease out something you just touched on, Siobhan, which is this question of being in a place. Can I see a quick show of hands? How many people with us here today live in the Seattle metro area? Okay, hands down, thank you. Me too. Hands up if you don't live in the Seattle metro area. Okay. Yay, thank you. Thank you for being here, especially to those of you who had to commute some distance to join us today. So Washington is widely seen as a heartily blue state, but we know that reality on the ground really, really differs depending where you are in Washington state. There are spaces and communities here that are highly politically contested. And so Siobhan and Rhonda, as two people who work in those spaces, can you talk a little bit about or share an example about what the reality is like in your communities on the ground, particularly for those of us who are in a blue bubble right now? Mia, knowing that you are in a very purple area, I'll invite you to weigh in as you want to. Sorry, Shalimar.
I love the question, and I have to gather my brain a little bit. Went a bunch of places. Maybe we can all just take a breath. Thanks. We actually do that at Firelands a lot. We start a lot of our meetings with grounding because this work takes the very best we have. We need to give each other everything the best we can. And so we ground a lot. So that's something I learned at Firelands. But I want to say a couple things about that. So in rural regions like Aberdeen, Alma, Montesano, Raymond, the kind of cultural reality we're being exposed to at the national level has been the sea people have been swimming in for a long time. The levels of disinvestment, the resulting despair, and the rising white nationalism narratives and the racialized scarcity narratives that drive us to close our doors and fear each other have been normalized there a lot longer than what we're seeing on the national stage, and that is important. And, in Aberdeen, or Grace Harbor County is one of the poorest in the state as well. We have the highest per capita rate of incarceration. We have the highest rate of deaths of despair. The actual conditions are poor, very poor. Like, it is rough. And when your day-to-day life is rough, and almost everyone else's day-to-day life is rough, and you can see the evidence of the big corporations that have rigged the system and taken your jobs and poisoned your land, the first thing you see when you drive into Aberdeen is a Superfund site on the Chehalis River left there by the Weyerhaeuser Corporation. And that day-to-day reality has created the conditions that the far right has taken advantage of to divide working people. I heard Marie tell the legacy of how working people have saved America over and over again since this wasn't a country, since this was other people's land, and it still is other people's land. And so, I think what we're trying to do in that context is recognize that the fight is at every level. We can no longer win at the federal level. We have pivoted every of our big, bold plans to win federal money for thousands of good union jobs, making all our homes climate resilient in Grace Harbor County, where the waiting list for the home energy repair and weatherization program is 200 years long. So that won't work. That doesn't give people faith in government. So we've paused that, but we recognize that the fight is at every level. And our power assessment of our local government is generally it's controlled by a good old boys club that is not showing up for the people, although a Firelands member is running for this Aberdeen City Council right now. She cut her teeth organizing in her mobile home park. They won one of the third statewide rent stabilization law in America, and she is running for local representation because she got tired. So I lost my train of thought again. I didn't ground long enough, but I think but the last thing I want to say is the fight is also at the state level, and thank God for Washington State. Like a little political education, there are some key state laws that are making it possible for us to keep going. One is Keep Washington Working, which is, people say it's a sanctuary law, but it's actually a very boring technical bunch of rules about how state agencies and local governments and local agencies can and cannot collaborate with federal efforts to kidnap people and detain them. And we have work to do it to hold the line for Keep Washington Working and to make its implementation full. My heart broke my heart broke and my stomach sank when I read that our state health agency, sorry, I'm getting the name wrong, actually, I think accidentally, did submit a bunch of data about undocumented folks who had finally gotten access to health care through a fight that Firelands was part of, that probably many of us were part of. But we're hearing directly like people are walking away from that program now. They can't. I mean, besides the fact that we're going to have to fight for the money because we don't have enough progressive taxes to actually fund all the programs we dream of. But so I'm going to stop because I'm getting rambly. But thank you.
I think that I was, before this started, talking with my friend Sherry from the Yakima YWCA, who you'll hear from a little bit later. But one of the things that we are very mindful about in Yakima is we have to be careful where we go. And there are many organizations that are like-minded and groups that are like-minded like us. But because we are a medium-sized community, we all know each other, and we are very mindful about our local policymakers and where we represent us and our organizations. So being in a conservative community, we are always mindful of where we go and who we represent because of how it might affect our own organizations and the people that we serve. We are advocates and not activists, because being an activist in our community would not serve us well or serve the people that we serve well. And, I would just share one example. I think we're running low on time a little bit here. So I'm going to share one example where I think we were viewed, my organization was viewed as going against the grain. We don't have any public hygiene facilities in Yakima. And at first, let me just say, because I talk about homelessness a lot, my organization serves, we serve about 25,000 unduplicated people every year, about 100,000 visits. About 40% of the people we serve are agricultural workers. 14% of the people we serve are people experiencing homelessness. I talk about that a lot because it is a group of folks with a lot of need. 14% of our population, some days they take 90% of our time. So to keep it in perspective, we, for the last 15 years, our local homeless coalition, our network, we had been working on trying to get public hygiene facilities for unhoused people in our community, and we found roadblock after roadblock on reasons what that couldn't possibly happen. So during the public health emergency, we at Neighborhood Health, we found a funding source to be able to buy a hygiene trailer, a shower trailer. So we did. We said, we'll just, the old Mickey Rooney days, again, I'm aging myself, we'll just do it ourselves. So we did. We bought a shower trailer. And so then the challenge was to find a place where we could take it. Well, the city didn't want to give us permits, the county didn't want to give us permits. So the answer is, because of state law, thank you, Washington, we could put it on church properties. So once a week, we take it to one of our church partners, and then another day a week, we take it down on the Yakima reservation, because they really wanted us, because there are a lot of unhoused folks on the reservation. And we've had it for 3 years now, and this service explodes. And so, and the purpose is, it's not about giving people showers, it's about outreach and engagement, right? We have a team of community health workers and behavioral health staff and nurses. So we have met people that we didn't know were even there. And we have an incredibly active outreach team that go down by the river and in the alleys and in the orchards and meet people, engage them. So with the shower trailer, it is out now 2 to 3 days a week, and we give, in a 5-hour period, anywhere typically up to 25 to 30 showers. But before and after, there are community health workers engaging, talking about services. Everybody gets a brand new clean pair of sweats, a snack, something to drink, talk about services, with the hope of engaging folks into services that they might need: medical, dental, housing, behavioral health services. So in the last year, we met we met 500 people. We gave 1,600 showers. 100 of them started behavioral health services. 330 engaged in medical services or medication-assisted treatment. And 300 of them engaged in housing, or at least got on the housing wait list. Well, since that, then our county commissioners have decided they want more of the housing trailers, the neighborhood showers. It's called neighborhood showers. But it's all about, people go where people are wanted. And, nobody wants to go where they're not wanted. But outreach and engagement and I guess, proving ourselves and proving that people, want services. And one of our county commissioners at a meeting said, what I learned about these folks is that everybody, even though so many of them had substance use disorders or mental health disorders, every one of them had the will to live. Well, go figure, right? So even in conservative communities, you'll find people that have the will to live. So we have success stories.
Oh my goodness. Just a real quick thing I'll say. Vancouver, Washington is I would personally say very squarely purple. Something that I constantly am yelling internally about is that I don't think legal aid should be a partisan issue. I don't think saying that anyone should be able to have access to an attorney, that by being able to afford an attorney and having better outcomes, that's unfair. And I think anyone who thinks otherwise, I just don't understand that logically. Kick rocks, honestly. Truly. And I will say in a kind of a bittersweet point is that now that the rule of law is such a topic of conversation, who'd have thought? The one way that we are benefiting by that, and I also want to get a little soapboxy here, and in the interest of saying to people to kick rocks, that suddenly now that laws are affecting white men in power or white folks in power, suddenly now we care about it. So if we can use that to our organization's advantage and suddenly say, hey, this is why we're so important after all, this has been affecting BIPOC folks, this has been affecting low-income folks, this has been affecting folks who are undocumented, but suddenly now that you care, we'll take it, I guess.
Thank you. Okay, we have just a couple of minutes left and 2 final questions. I'm going to ask you each to share what gives you hope in these times, and then come back for some an accelerated round. So what gives you hope in these times?
I'm gonna keep this short, I promise. So my great-grandfather was a sharecropper, and I was blessed to be able to know him all the way through kind of my early teen years. And he settled out after he left Alabama, moved to the West Coast and to San Diego, and was farmer in San Diego, and bought several pieces of property, and that helped sustain our entire family. What gives me hope, and the reason why I bring that story up is because when he settled, he was very intentional about settling near other black farmers, because that is where the community is. And that is what gives me hope, is that at the end of the day, when I go home and I'm exhausted and I'm like, oh my gosh, I've told so many people to kick rocks today, that I think about the work that we do, and I say, did we do it in concert with community? And did we do our community justice? Because they are giving us a lot of faith and a lot of trust that we are helping to represent them and serve them in the way that they ask. And if the answer is yes, then I go to sleep very well. If my answer was no, then it means next day I got to get up and do a lot more work. So, thank you.
I'll say it sounds kind of cheesy, and I'm getting this question a lot right now just because the nature of my job is how do you keep yourself hopeful? How do you have hope? Truly, it is being in spaces like this. It's being around folks who care, who see what's going on, who are also telling folks to kick rocks. That is really what gives me hope. Something that we lean on a lot is the Mr. Rogers quote, look for the helpers. And I think right now we're in a room full of helpers, and that really makes me feel good. And on the days when I can't tell people to kick rocks, because we are squarely a 501c3 and I have to be very careful of what I say, I just look around and see that there's other people doing the work. There's people showing up in such huge amounts that I would have never expected, locally, statewide, all over. And so feeling that we're all in it together. You know, sometimes it feels like nonprofits, you're just scratching the surface of the issue. But then I talk to amazing folks like this and see that there's so many of us scratching that issue, and it feels a little bit more doable.
100%. History, we've been worse places before, and people who've had it much worse than me imagined like America could be a place to stay and to love and to fiercely protect and fight for. And when I want to lie down and say, well, this bully tells me a good bedtime story, I'm just going to lie here. I remember that. And I really think it's solidarity that gives me hope. It is solidarity for sure. And I think I learned that growing up in a tiny town where no matter what your politics, if your house was on fire at 2 a.m, the volunteer fire department would come to your home and risk their life to save yours. And that taught me that solidarity can literally save you. And it's a lesson I just learned over and over again, and I'm so grateful to be at Firelands where I see that solidarity happening every day.
Well, similar to what you just said, I see more people in my community coming out and having their voices heard, and I think that's what gives me hope. I was at another board meeting yesterday here in Seattle, but of community health center leaders from across the state, and one of my peers leaned over to me and he said, and his words were, "Isn't it days like this that you find so much value in your friends getting together and talking about not just what their successes are, but their challenges and being together?" And so I think that gives me hope. But also, I think about in Yakima, the rallies that I can't attend, but I look at my friends that are there and the number and the volumes of the people that are showing up to have their voices and their opinions heard. It's greater than it's ever been, and that gives me hope.
And Rhonda, we'll start with you and work back. You have a captive audience in many ways right now. We're all here to hear from you. What is one action step that you invite each audience member to take as they leave today? And what is one resource that you'd like to share with folks who are here because they care about this work?
Well, the obvious one is vote. But this is probably an audience I don't need to say that to.
I thought you were going to say money, so
well,
you can do both.
That's on the resource list, but I think that talking to our policymakers is huge. It's about influence, and I think people need to hear. Sometimes I think people don't understand the impact that it's having on the people that we serve. But, I talked earlier about if we don't have, we're a few days away from the government shutting down. And I feel like I've been talking to my staff nonstop about what the impact this is going to have on the people that we serve. But I had an email last night. We have an anonymous suggestion box where people can or staff can send me information, and I had one last night. It's called Incognito. I had one last night saying, "Is this going to affect us?" And I just talk about staying awake at night. I felt like I have just failed by not being a good communicator. But are we going to be able to pay the rent of our tenants on October 1st? So resources, money of course is an issue, but we need people to understand the everyday's impact on these decisions that our policymakers are having. They have to be able to do this. So talking to our policymakers about the real impact on people's lives. And so the two resources that I made notes of, one is the League of Women Voters. I am a member. I am an active supporter. I think they give great information regardless of what party you belong to. And then the other for the health information and the laws that are passing through, I recommend the National Association of Community Health Centers because it's real time and they give action steps on legislation that affects the health of the people that we serve. And if anybody has, for funding options, we certainly have lots of unfunded services for the vulnerable populations that are not in favor right now that we could certainly put good use to.
Well, I feel like the room is probably pretty abundant in resources, so maybe just talk to each other more. But one I will offer is if you're trying to make sense of these times, there's a Substack, there's a newsletter by Scott Nakagawa, who's an organizer from rural Oregon, who also runs a group called the 22nd Century Initiative called the Anti-Authoritarian Playbook. And it's got history lessons, it's got practical lessons, it's got what the heck is this information. It's awesome. So I recommend that. I also recommend that you Google the speech that Stacey Davis Gates gave. She's the president of the Chicago Teachers Union. It's a 5-minute speech. She gave it at the Workers Over Billionaires rally. And I've literally been watching it daily for 4 days because it's giving me so much sustenance. So Stacey Davis Gates, Chicago Teachers Union. Google her speech.
I guess my action item would be just to stay strong, stay together, stay in solidarity. I think we all know that the constant news, the constant feelings of disillusionment, it's intentional. It is supposed to make us feel like there's nothing that we can do. And I think as much as we can push back against that and remember that that is a tactic that we can get in front of, the better. And the one resource I would say is right now, if you have any folks who are undocumented or even documented immigrants in your life, to do a family safety plan, to do a preparedness plan. It's essentially a very quick power of attorney plan that says if you have minor children, you're gonna designate this person to take care of them in the case that you are deported or otherwise detained. There's not a whole lot that we can do right now to prepare, but that is one very real, tangible step that can be done. And I would highly recommend looking at, it's called the Legal Council for Youth and Children, LCYC. Their website has informational packets. It includes the court forms. So helpful. Really, really check it out. And fund legal aid, please.
Money. I'm just going to say it, money. But it's the thing that I always remember is that my ancestors carried a tremendous burden to have a world that they knew that they would never see themselves. And for us in this moment, we are doing a lot of work. All of us in this room are doing a tremendous amount of work to envision a world that we ourselves may never see, and that's okay. The idea is that we keep doing the work despite the fact that we may never see it ourselves. That's what I want people to remember. And how you do that is to connect with one another, to actually like for real connect, not just like, oh, hey girl, yeah, I'll get your information. Like, but for real, like send the email, have the conversation, have the phone call, have coffee, whatever it is, have the cocktail, whatever it is, so that way you truly have your own community in these rooms. So when we need to lean on each other, when we need to be like farmers and we know that they turn the soil, so that way things can grow better. Like that is what we're doing right now. So please keep doing what you're doing and also give us money.
Well, I'm sure I'm not the only person in this room who is feeling additional hope right now because of the work and leadership that you are all showing in your parts of our state, in your parts of this world, in your very critical efforts to build a more just future. So please join me in thanking our panelists.